for staging and cytological diagnosis of solid pancreatic lesions, pancreatic endoscopic ultrasound is coupled with fine needle aspiration. Different needle gauges, namely 19 gauge, 22 gauge, and 25 gauge, have been used for sampling pancreatic mass lesions. The diagnostic accuracy of EUS-FNA may be influenced by several factors such as the location, size, and tissue firmness of the lesion, angulation of the endoscope tip, experience of the endoscopist, and availability of on-site cytopathology assessment. The question raised in this paper is whether needle gauge may also impact diagnostic yield. Available studies provide inconclusive reports. To more robustly define the diagnostic accuracy of 22 gauge versus 25 gauge needles for EUS-FNA of pancreatic masses, Madhoun et al. Performed a literature search using relevant search terms and found 8 studies for meta-analysis using the following inclusion criteria. First, studies must compare the diagnostic accuracy of 22 versus 25 gauge EUS needles in pancreatic masses using surgical histology, or 2, the reports must include at least 6 months of clinical follow-up as their gold standard. The 8 studies involved 1,292 subjects. 799 were in the 22 gauge group and 565 were in the 25 gauge group. Both needles were used in 72 patients. They report their findings in a paper entitled "The Diagnostic Accuracy of 22 gauge and 25 gauge Needles in Endoscopic Ultrasound-Guided Fine Needle Aspiration of Solid Pancreatic Lesions, a Meta-Analysis," which was published in a recent issue of Endoscopy. Here is a summary of what they have to say. Background and study aims. It is uncertain if needle gauge impacts the diagnostic accuracy of endoscopic ultrasound-guided fine needle aspiration, EUS-FNA, of pancreatic mass lesions. The aim of this study was to use meta-analysis to more robustly define the diagnostic accuracy of EUS-FNA for pancreatic masses using 22 and 25 gauge needles. Patients and methods. Studies were identified by searching 9 medical databases for reports published between 1994 and 2011 using a reproducible search strategy comprised of relevant terms. Only studies comparing the overall diagnostic accuracy of 22 versus 25 gauge EUS needles that used surgical histology, or at least 6 months clinical follow-up for a gold standard, were included. 2 reviewers independently scored the identified studies for methodology and abstracted pertinent data. When required, the original investigators were contacted to provide additional data. Pooling was conducted by both fixed effects and random effects models. Diagnostic characteristics, namely sensitivity, specificity, positive and negative likelihood ratios, with 95% confidence intervals were calculated. Results. 8 studies involving 1,292 subjects met the defined inclusion criteria. Of the 1,292 patients, 799 were in the 22 gauge group and 565 patients were in the 25 gauge group. Both needles were used in 72 patients. The pooled sensitivity and specificity of the 22 gauge needle were 0.85, 95% confidence interval 0.82 to 0.88, and 1, 95% confidence interval 0.98 to 1, respectively. The pooled sensitivity and specificity of the 25 gauge needle were 0.93, 95% confidence interval 0.91 to 0.96, and 0.97, 95% confidence interval 0.93 to 0.99, respectively. The bivariate generalized linear random effect model indicated that the 25 gauge needle is associated with a higher sensitivity, p-value 0.0003, but comparable specificity, p-value of 0.97, to the 22 gauge needle. Conclusion. This meta-analysis suggests 25 gauge needle systems are more sensitive than 22 gauge needles for diagnosing pancreatic malignancy.